Goeienaand, good evening, fellow South Africans and citizens of the world. And we just had a fascinating live stream with Clint, who used to be Eugene Terblanche's bodyguard back in 1994 through to about 1996. But if you want to know some of the things that went on behind the scenes, you got to go and watch that live stream. It's on this channel in the videos. You'll see it there. It goes for about 2 hours. Okay, now let's get to the subject here. And again, it's the old coronavirus that's raising its ugly head. And it's interesting because weeks ago, and I mean probably a month ago, I have been warning people in South Africa about the impact of the coronavirus when you look at the complications of HIV/AIDS and TB, which lowers the immune protection system within the human. And that's exactly what this coronavirus attacks, and a lot of people die if they're in that situation. So the 3% that they're quoting in China as the average death rate after infections is clearly going to be a lot higher in South Africa. And some of the information I've been talking about for, as I say, weeks is now just starting to come out in the mainstream media in South Africa. And they raise a very interesting comparison here. At present, tuberculosis is the deadliest disease in South Africa, but the coronavirus could soon be its greatest competitor. According to statistics published by the World Health Organization, 63,000 people died in South Africa in 2018 due to tuberculosis, while the disease affected the health of approximately 301,000 people. The Freedom Front Plus believes that these estimations are conservative and that the actual number probably lies between 215 and 400,000 people. South Africa has more than 880 new infections every day. It is the country's biggest cause of death, and matters are made much worse by the HIV epidemic, as approximately 7.4 million people have contracted the HIV infection. Now, those are people who are probably registered. I'd say the HIV rate is probably double that at least. Anyway, seen in the light of this, it is clear that corona could wreak havoc in South Africa. If the government is not even able to win the fight against a curable disease like tuberculosis, it raises questions of whether it'll be able to protect South Africans against the coronavirus. Medicine must be available at all times. A report by the Treatment Action Campaign, however, indicates that the country's public health system is so dysfunctional that it is sabotaging the implementation of HIV and tuberculosis programs. Get that? It's sabotaging the implementation. The National Health Insurance Scheme will be a total disaster. Hospitals and clinics are in disrepair and cannot provide adequate care and treatment to tuberculosis patients. The Freedom Front Plus is opposed to the National Health Insurance Scheme, seen as our current healthcare system is not even functional. With regard to corona, all medical support and even pharmacy personnel must be provided with the necessary protective gear. They are in the front line of defense in the fight against disease and must therefore enjoy protection at all times. Now, there's not much more I can add to that because we've already covered this, as I said, weeks ago. The only thing I can say, and again stress to people, is please make sure you prep. Prepping is where you've got supplies of tinned food, dried fruit, water, toilet paper, all the necessities of life. You've got to have supplies of those that'll last you at least a couple of months. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.